Hello, everyone. My name is Dr. Jordan Odell. I'm the owner of Transcend Wellness Chiropractic. I'm a chiropractor who focuses in neurology as well as functional medicine nutrition. So, one of the main things I'm always talking about with my patients, their poo. This can, for me, be a big indicator of if there's, things going on with their gut health. And for me, I really try and educate my patients. So I want them to know, before they even come into my office, is there something going on? Is there something I should be looking out for? So that's what I wanted to give you guys today was just knowledge about your poop, things to look out for, what it means. We're going to go over size, consistency. We're going to go over color. We're going to go over timing and what these things can mean and what they can mean not just for the short term going on with your gut health, but also what these things lead to long term. I'm also going to give you some tips on what you can start doing right now to start actually improving your gut health, to start helping with your poops. So let's get started here. And the question is, how do I know if I have a healthy gut? Look at your poo. So, what is poo? Basically, it's the leftovers of what we eat, as well as the toxins, the chemicals, the hormones that our basically liver processes and is getting rid of. So, think toxins in general. We don't want to reabsorb old hormones. We don't want to reabsorb chemicals. We don't want to reabsorb toxins. So there has to be an elimination process. And that's why it's so important for us to have consistent transit time through our gut for removal of all these waste products, is because if not, we're going to reabsorb them. And a lot of times what happens with that, because our gallbladder releases bile, bile is one of our main binders in our system to bind up all the toxins that move through our digestive tract so it can kind of just be taken out. Well, we reabsorb our bile, so anything that bile is holding on to that's a toxin, we reabsorb back into the gallbladder. And this is actually a lot of the times why people end up with a sluggish gallbladder that turns into stones and blockages and all sorts of issues moving forward. So we want to have healthy poops to help avoid some of these things. So yeah, this is what your poo is. So what is a normal amount to go? It's my favorite thing to ask my patients is how many times a day do you go? Most times I hear one time a day. Sometimes I hear less, sometimes I hear a little bit more, but most commonly one time a day. And I ask them, do you know what normal is? And they're like, well, I thought this was normal. So the normal amount we should go 12 to 24 hours after you eat something, that stuff should be coming out of you. So if you eat 2 times a day, bigger, let's say normal sized meals, you should be pooping about 2 times a day. You eat 3 times a day, about 3 times a day. So for those of you who are just going once a day or once every other day, and even if you're going, let's say twice a day, but it doesn't feel like a full empty, it's just little amounts, this tells you your gut is struggling and needs some help. All right, next thing. What is your poo telling you? All right, so your poop right off the bat is going to tell you a few things. It's going to tell you potentially, do you have gut dysbiosis? So if you have slow transit time, you're not pooping, the amount that you're eating 2 to 3 times a day, likely there's probably some gut dysbiosis going on, especially if this is a long-term thing. It's not just kind of a short-term, happens every once in a blue moon. Gut dysbiosis. So what this means, we have this whole microbiome, like think of this ecosystem in your gut that's made up of bacteria, it's made up of viruses, it's made up of potentially parasites, and it's made up of yeast. And this fine balance, especially of, more beneficial bacteria, is what allows us to digest food properly, to actually make certain hormones, make certain neurotransmitters. So that's even like what affects, our brain and our mood, our emotions. And our gut bacteria are going to play a huge role in our immune system. So, not getting chronic diseases or cancers or, other issues later on is all going to be really affected by this microbiome. So dysbiosis is when those things are out of whack. Either, let's say you have too much yeast that's overgrown, you have more of the bad bacteria versus the good, you have parasites that aren't helping you out. So this is dysbiosis, microbiome that shifted the wrong way. So that's what your poop could be telling you that you have going on. It could also be telling you potentially have a disease state like Crohn's disease, potentially diverticulitis. So again, some more kind of chronic GI issues now because they've been going on likely for a while. abnormal tissues like polyps. So if you ever see kind of your poop look like a ribbony shape, this can be a sign of polyps. It can also be a symptom and sign for things like Crohn's disease. So if you have this consistently, take note. It's not normal, and it can mean there's bigger problems going on. And also, again, it can mean something like your poop, let's say, being a greenish color or white color, can mean that certain organs are struggling, like your gallbladder, for example. And I know I kind of talked about some gallbladder issues just a second ago. So just keep in mind, right, like right off the bat, this is acutely some things that your poop is telling you, but long term, these are going to have even greater effects. So let's get into it. Shape. So I want to kind of zoom in a little bit so you guys can see just a bit more. This is called the Bristol Stool Scale. All right. So this basically says, different shapes of what your poop should kind of look like. So 3 and 4 is considered normal. 4 is gold standard. So 3 is basically log, with just a little bit of cracks in it. And then 4 is going to be this nice, consistent, just like snake-like poop, not really seeing any cracks. And that's kind of the gold standard for poop. Type 1 and type 2, now this is going to be when you're usually more on the constipated side. Hard like pellets, rabbit-like, not normal. Logs with cracks in it, again, some form of potentially dehydration. If it's not that, potentially gut dysbiosis. Something is slowing down the transit time that your water is getting reabsorbed. So let's say you're not having enough water, that's one thing. But let's say you are having enough water. The transit time is so slow that the water is getting reabsorbed, and basically your poop is getting harder and firmer and smaller with cracks in it. So both problems both mean something's going on. The last 2 types, or last 3, so kind of looking 5, 6, 7, this is getting more onto the diarrhea side of things. So even when our stool, let's say it's no longer this formed snake-like, but now it's more froyo-y, maybe turned into a mud pie, these are mild forms of diarrhea and are telling you, there's something going on with your gut. And again, this is usually more consistent. If you had this once randomly, you know what I mean? I wouldn't say it was as much of an issue, but if you're having this consistently or it's coming and going, this is a problem. So types to look out. Look up the Bristol Stool Scale if you ever need to know what your poop's saying in terms of shape. All right, let's take a look at color. All right, I will zoom in on this a bit again. Oh, let's go back. Here we go. All right, so zooming in. Color. So green stool. Let me just go over normal real quick. So normal is typically always going to be brown, and that has to do with basically your bile is normally this greenish color. When we digest it properly, it turns brown. So normally our poop should be brown. And again, poop color can vary slightly depending on what you eat. So don't freak out if, let's say you had a huge, green smoothies back to back and all of a sudden your poop was a little bit more green. I've even, heard of parents, their kids eating a box of those multicolored goldfish and their poop coming out a weird color. Well, there's lots of dyes in there. So your food can influence this, but overall, your poop should be brown. So if you see different colors and it's not really correlating as much with something you ate, because even if you ate, typically normal amounts of fruits and vegetables, your poop still comes out brown. So start to question it. So green could mean undigested bile. So now again, what's going on with your gallbladder? Is it struggling? Yellow could mean, again, gallbladder problems, can also be indicative of a Giardia infection. So this is something that you can get from contaminated, usually water, if you've been out hiking or anything like that, and drinking water from the stream that wasn't kind of purified. Red. So red colored stool can basically, if it's bright red, mean that there's a lower GI bleed. So you could have basically a hemorrhoid that bursts lower down closer to the opening. You could have lesions that are bleeding. But again, like lesions, polyps, these are all signs typically of some sort of inflammatory, potentially bowel issue going on. Maybe something like diverticulitis, could be irritable bowel, Crohn's. Other things can just be indicative of those things. So lower GI bleed is not a good thing, especially if you're seeing it consistently. Sometimes, right, we can eat something and our bowels can get irritated for a quick second, but overall, ask your doctor if you're seeing, blood in your stool. The other side of it is actually black stool can be indicative of also of a GI bleed, but it means it's coming from higher up and that blood is getting digested now. So I could expect potentially an ulcer or something like that to be the cause of an upper GI bleed and causing your poop to be black. So dark tarry or black looking stool is not normal. So yeah, be on the lookout for that. White. So could mean some liver issues, again, could be some gallbladder issues, or it could mean that your bowels just are not absorbing fat well. So fat is just not being digested and broken down, and it's showing up as this color. So I talked about black, and mind you too, some of these colors, like for example black, can be from medication. So don't freak out if you start seeing this just yet, and think about if you're taking any medications. You can always actually go to rxlist.com, and that'll show all the side effects of medications you're taking, and they should in that point list stool color changing if it is a side effect. So that I've even seen black stool from people taking Pepto-Bismol and things like that. So keep in mind medications. Mucus. So GI distress is usually when we're producing excess mucus. It means our gut's not happy, and it's trying to usually kind of get things out a bit quicker. So things become a bit more mucusy. Something else I wanted to kind of talk about was just, some of these things can be correlated. Let's say if your poop is diarrhea-y with infections. Fluffy stool. If you've ever seen your poop where you kind of like it hit the water and it kind of went like that is not a healthy stool either. So if that's happening consistently, know that likely you're lacking something, or your gut isn't able to absorb something to basically help that stool to harden. So yeah, and then pencil thin stool is not good. All right, let's have us go back out, and I want you guys now time. So how long from the time you sit on that toilet to actually go, how long should it be? Not an hour, not 30 minutes. It should usually only take a few minutes for us to actually use the bathroom. So if let's say you checked off all those markers for, you go twice a day, it's a normal color, but it's always a bit of a struggle. This can be, you can have pelvic floor or musculoskeletal issues that could be a cause of this, but also there could be something going on with your gut health that is just harder for the contents to come out, and it takes you more time. So it doesn't always necessarily mean dysbiosis or a gut health issue, but it can definitely mean that something's going on with the musculature, the fascia, your colon in general there. So by the time we get on the toilet, we want to be going within, a few minutes. So much interesting info, right? Who knew there was so much to poo? All right, so what affects your poop? So the main things that I see, right, that are affecting why our poop is coming out weird or not enough, it's usually, number one thing I see with patients is the foods you're eating. The standard American diet, a lot of processed grains. Think about the breads, the pastas, the packaged foods, anything in a can. So lots of sugars, lots of grains is typical for the American diet. There's nothing there really that your gut feeds on, your bacteria feed on to keep them healthy and to keep your bowel movements healthy. So it's so important that we are eating to keep our microbiome happy and thus keeping our gut healthy. So foods are the biggest thing I find with people, and usually there's food intolerances going on, causing a lot of excess inflammation, slowing that transit time too. So I always want to check on people's foods. The next thing is, what's affecting your poop? Well, GI distress. I keep talking about this gut microbiome imbalances. This is usually when people have chronic issues going on, and that includes not pooping, more than once a day or whatever, color, things like that. Lets me know that there's usually a microbiome imbalance going on. Stress is a big one. A lot of people don't realize, but actually stress just doesn't affect you. It actually affects your gut bacteria. So figure out some ways to not be so stressed. Alcohol is a huge one, and it's funny because, right, there's even research that shows, okay, a certain amount of drinks is okay for you to have weekly, but then there's other research that is studying more the microbiome, and some of it shows that basically, like, an adult male having drinks, let's say 2 drinks a night, will end up with gut dysbiosis. That's just what's going to happen. A female having one drink a night will end up with gut dysbiosis. So I know a lot of people like to have a drink to de-stress at the end of the day, but I can tell you it's definitely not helping your gut and it's not helping your long-term health. So figuring out just some other ways to kind of minimize that alcohol intake is huge. Hormonal changes. So any of you women out there who know around your cycle, things can change in the bathroom. Back here, we were at what affects your poop. So the next part is journey to a healthy gut. So how do we basically start helping your gut after we realize, okay, my poop's telling me there's something going on? So I wanted to give you guys kind of my process that I go through with my patients, and then what you can start actually doing at home. So coming right here. So the first thing I'm going to do is find hidden food sensitivities. So looking here, right? Energetic testing is what I typically do in the office with patients. A lot of times too, well, not a lot in my office, but labs are typically done, or an elimination diet. Elimination diet is something that you can do at home, but it can take quite a while to figure out what foods are causing excess inflammation in your gut, causing your GI issues. So the energetic testing I do in the office works very well for finding those answers quickly, and lab work can also be a good option. So the second thing is, now that we know what foods are kind of causing excess inflammation, second part I want to know is what else is in there? So what kind of bad bacteria, what kind of potential other infections are going on? And so a lot of times in the office, based on somebody's history and symptoms, I can tell a lot about what potential infections are going on in there. I'll follow up with energetic testing as a tool to help me kind of figure out some more of those answers. Comprehensive stool analysis is a big one that people use in this world to figure that stuff out. So food sensitivities, what's going on in the gut, but things that you can kind of start doing at home. Let's say if you just wanted to see if making your own changes could be beneficial or not. So I would recommend adding in more veggies and taking out the processed foods, or limiting them, like really limit the processed foods, increase that vegetable intake. If you could have veggies with every meal, and start off slow because your GI tract may not be used to the fiber content yet, which could increase gas or bloating. So start out, okay, if you're eating veggies only once a meal, include it for twice a meal for a week, include it for the third meal, and try and be as consistent as you can. If you can't get it in cooked meals, have it in a smoothie with some fruit, some, nut butter, stuff like that, just so you can get it in, because the veggies is going to be one of the biggest parts to getting your gut microbiome back on track. Now, based on if you have food intolerances, and if you've been dealing with some gut health issues, likely there's probably veggies and fruits that you shouldn't be having, which is why I like to do the individual testing on patients so they exactly know what they can have and what they can't. But again, if you wanted to just start doing some things at home to start trying, definitely increase your veggie intake. The next thing would be water intake. So if you're already not drinking enough water, a lot of the times, living out here in Arizona, I tell people, especially females, minimum 90 ounces. Bigger guys, I'll tell them up to a gallon. During the summers, sometimes it could be double that depending on just how much you're moving and sweating. So think just trying to get more water intake in. Exercise can be a huge one. When we actually use our core muscles, it helps move everything. So if you're not exercising, doing some of that can definitely be beneficial. So those are kind of the three things that I would recommend first. All right. So how to start healing. So other things to try. So this is more for if you maybe deal with more constipation issues or diarrheal issues. So I kind of wanted to give you guys some options here on things that could help. So pulling this up, fiber supplements. So let's say you're struggling to get veggies in, you could take a fiber supplement. Usually insoluble fiber is usually what people are missing more so, but sometimes it's good to have something like a resistant starch you can see down here that's going to have soluble and insoluble fiber. So if, let's say, you were dealing with diarrhea or constipation, this could actually help either. Something too, if you're dealing with constipation, magnesium oxide or magnesium citrate. These are the best forms of magnesium to be able to take to help with your gut, moving the poo out faster. Probiotic isn't always my first go-to for a few reasons, but it's something that sometimes people can try at home on their own and they do notice a difference, so I still put it on here, and there's usually not a lot of harm. But if you start noticing gas or bloating, stop the probiotic. Decreased stress is one we already talked about. Decreasing alcohol and caffeine intake. Try just cutting your alcohol and caffeine intake, if you could, in half, and see if you notice a difference. People will also notice a difference in their energy. And that's something too. When you start pooping more, let's say if you don't go very often, you'll notice decreased brain fog, more mental clarity, more energy. You'll usually just notice feeling better overall. And then if you're feeling constipated, a trick that I sometimes use is high dose vitamin C. We can take about 2,000 to 4,000 milligrams. But I would usually start out at about 2,000, wait 45 minutes to an hour, take another 1,000. So yeah, those are some things that you can start trying at home. And the next thing here, boom, boom. Thanks for hanging there with me, guys. So if you have any questions or need help, feel free to contact me. I just have my website listed, www.transcendwellnesschiropractic.com. My email's there, and that's also actually my personal phone number. So if you guys have any questions or concerns, feel free to shoot me a text. I might recommend, if we're texting, setting up just a free phone consult so we can basically just discuss stuff further. And if you find this information helpful, go ahead and subscribe to my YouTube channel, but also take a look at my Instagram. I post a lot of really good content on there. So thank you guys for watching, and I hope you have a great day and learn something about your poop.